So, our periods, yes, our periods can be affected by our stress. I think instinctively we all know that. The thing about the periods is it's not just periods we're talking about heading into menopause as well. So as we tackle this fairly large topic of the effect of cortisol on the female system that resides within a greater endocrine system. I'm actually going to use my hands in the same way I have in my other videos. Cortisol's over here, the other hormone's over here, okay? So we have an elevation in cortisol. That's going to push a pathway called aromatase. Now that gets all fancy and complicated, so I'm just going to swipe that aside. And I'm going to say that elevations in cortisol affect the body's ability to produce the optimal kind of estrogen in the female system. Now I have to chuckle when I do this because I just did the testosterone cortisol video, the male, it's not just male hormones, but I'm speaking of the men. And it was so simple. And now I'm like, okay, ladies, let's just do it the way we typical women do, and let's get into the meat of it and get into the details and think it through, and it's really complicated. So let's go. Estrogen has many hats that it could wear to make it look like many different things. We've got estrogen, we've got estradiol, we've got all these different like E1, E2, E3, E4, all these different kinds of estrogen. Each one binds to the cell receptor in a different way. I've given a fairly good explanation of what I mean by cell receptor in the blood sugar video. So I'm going to refer you back to the blood sugar video. It'll be good for you to watch anyway, so that you can understand that. So before we get into this highly complex video about females, go watch the blood sugar thing, learn about cell receptors, and then come back, okay? Okay, so now that you're back, we've got estrogen that then comes into a cell to bind to it to create an endocrine function or dysfunction that affects our menstrual cycle in some way. So, estradiol is the most common lab test we use, in primary care at least, for checking estrogen levels overall. Now, estrogen can be tested in great detail in other tests where you spit in a cup. But for your regular run-of-the-mill estrogen progesterone ratio and how estrogen and progesterone are acting together, because estrogen and progesterone are in close communication with one another. They're sisters, okay? So you've got like this like really, if I could boil it right down and get rid of all the physiology and the complication behind estrogen, estrogen has the personality of like Xena warrior princess. She's that tough ass. She's that CEO type. She's that like estrogen. If that was a person, a human, she wouldn't be very balanced, but she'd be like, rah, don't mess with me. Sit down, that sort of thing. Whereas progesterone, again, without estrogen, progesterone is not very balanced either. Progesterone is very gentle, very sensitive, very kind, but also very thoughtful, very empathetic. Progesterone is that type that's just very responsive to everything. Not a whole lot of, it's very fluid, a lot of fluidity, but there's that lacking of boundaries. And so the reason I've described estrogen and progesterone as if they were women is because I will actually see these personality traits coming out in my patients, and it actually helps guide me as to what's possibly going on in the hormone system. So if I'm seeing someone come in who's saying to me, you know, I'm hypersensitive lately. Like I can't seem to, like everything affects me more, and I'm not used to this. I'm usually fairly robust, and I can kind of like keep things in perspective and not take anything, you know, not take somebody's vibes too personally. But I'm feeling really sensitive lately. I say, okay, well, you know, how have you been doing? Well, I have been working a lot lately, and I did, you know, I got to take care of my parents now, and, you know, or something else is going on, or I just had, you know, my third child, and I'm really like burning the candle at both ends. I've been doing that for years. My periods are not, they're not great. Like sometimes I'll just bleed and bleed and bleed and bleed and bleed and bleed. And it just won't stop. Or sometimes, or I might hear, I'm not having much of a period anymore. Or I might hear my periods happen like I'll spot through the months. So I'll just like have a period, then I'll have a small period, then I'll have another one, and then I'll skip one, and then it's all over the place, and I can't seem to have a schedule. The blood is bright red. It's very watery. Might be normal flow, or it might not be. Now these are very, you know, this doesn't necessarily mean like guaranteed progesterone issue. I'm just giving sort of generalities to help you get your head around this. Whereas if I've got an estrogen dominant woman in my office, I love these women because I like strong women. I like all women, but I really do like a strong woman. And so they're going to be in my office, and they're going to get a little wound up when they're talking about it. Their voice is going to get really sharp. They're going to be enunciating a lot. They're going to be a little tense around the shoulders. Their face might get a little red. They're going to be intense in their energy as they sit in my office. They're going to be very animated. They're going to be frustrated. There will have been feeling a lot of frustration for a long time. Again, not guaranteed. That's not like my oh yeah, if that's happening, that's the estrogen. But that's fairly common, and it might be a little bit of a signal to me to check a few things. And then they sit back, they go, and I'm like, okay, well, tell me about your periods. My periods, well, they're all over the place. Okay, well, what's the volume like? I don't know. Less, I guess. And I'm like, okay, what's the quantity, like, what's it look like? What's it feel like? What's the texture of it? What's the color of the period when you're having your period? Darker, almost purple. Is there clots coming out? Yes. Is that normal? Yeah, well, kind of. It's not normal, but it's not harmful. It's not scary. Oh, okay, good, because I've been worried about it. All right. Okay, are they the size of a dime? Are they the size of a quarter? Oh, like, yeah. Okay, are they any bigger? Yeah, sometimes they're really big. Okay, big estrogen problem. It doesn't necessarily mean that there is too much estrogen in the body. It actually could mean that there's an estrogen deficiency, but that also there's a progesterone deficiency, because when it comes to estrogen and progesterone, it's all about the relationship between the two. Both could be deficient, and a person could be exhibiting signs of estrogen dominance. And so if you're being told that you have estrogen dominance, that doesn't necessarily mean that I have to like decrease estrogen levels and clean you out necessarily. It could mean that I have to actually boost your estrogen, but I also have to boost your progesterone at the same time. So there could be different kinds of estrogen. The body, building an estrogen is quite a process. Like it's not a simple molecule. And the body will take shortcuts if it's busy, especially if it's busy producing cortisol molecules. It'll take shortcuts in the production of estrogen. It doesn't that it wants to, but it does, because it has to. Cortisol is the priority under stress. If a person's subconscious mind, the automatic nervous system, okay, autonomic nervous system, the back half of us, if the part of the nervous system is of the opinion that we don't have the luxury of being in thrive mode, the circumstances of our life, the conditions of our world are not a thriving state, if our body has made that assessment, the body will prioritize cortisol production over other hormones. And it'll take a shortcut with its estrogen. Libido will likely go down eventually. Actually, libido is one of the first things to go. with elevations in cortisol that are moving past like functional into dysfunctional, where you're getting into like some sort of adrenal fatigue. One of the first things to go is your desire for loving touch. So, and of course there's other reasons for that, but that should be on your list. If there's a libido issue, could be that the adrenals are starting to get fatigued. The body's having a hard time keeping up with you. Apathy, grumpiness, frustration, lack of patience, lack of ability to just sit back and not be flung about by circumstances. I find that when there's an estrogen dominant situation, we tend to react quickly. And that could be because the cortisol is in there too, and you're gonna rise, right? Your blood pressure's gonna go, your face is gonna get red. There's gonna be some food cravings, to be sure, absolutely, because cortisol will automatically cause food cravings. Here's the complicated thing, as if estrogen wasn't complicated enough. Cortisol increases our blood sugar, right? It increases our insulin resistance. You've already went and watched the video, so you don't have to watch it again. Go back and watch it. Come back. As cortisol rises, the body wants high blood sugar. And then some other part of the body doesn't want high blood sugar. So there's an internal battle going on in blood sugar because cortisol's up. Okay, but cortisol will increase blood sugar. All right. When there's an increase in blood sugar, there is an increased risk of PCOS, polycystic ovarian syndrome, which is an estrogen dysfunction. Okay. This cycle feeds itself so that as cortisol rises and blood sugar rises, cysts on the ovaries grow. That increases blood sugar as well. Did you also know that increased blood sugar will increase cortisol levels? And it's this self-perpetuating feeding cycle that just spirals into a dysfunction. But the good news is we can spiral it out of the dysfunction. We can actually reverse that spiral so you can come back out of it. It's a process, right? Because endocrine stuff happens slowly. So we'll manifest our way into this like PCOS, estrogen dominant, blood clots in the menstruation, grumpy, not feeling like ourselves, blood sugar state. And then we'll just unravel it. We just have to unravel it. So that's what I do, is I look at that pattern, which is fairly complex, and I've actually really simplified it. It's a multi-step process, which, by the way, includes carb cravings. Okay? Zoop! So my job is to unravel that. When I recognize the pattern, I unravel it, okay? It doesn't take one session, it takes a few, and it takes some training, takes some supplements, takes some diet, takes a bit of work. But when things are working, that's not that difficult, is it? When you see things working, it's not that hard to do it. So it really is a matter of making sure that we treat this complex estrogen, cortisol, blood sugar situation in the simplest way possible, because it's already complicated enough. My job is to keep it nice and simple, get a nice, clean, crystallized plan for you that's going to work in a way you can get your head around, and also in a way that's practical. Because when we're in that spiral, that spin that causes that situation, we've already been stressed out for a while. We've already been trying to keep up with our life for a while. And so we unravel in a way that is practical and realistic. Because the last thing you need when you're in that spiral is to put more on your plate. My job is not to put more burden onto you. My job is to remove burdens. It's to help you redesign your diet, your life, your supplement regimen, your intake, but also your output, the blowing off of steam. All of it comes into play because there was a whole bunch of factors that came together to cause this spiral in the first place. As we take you back out, It's an offloading process. It's not an adding to the task list process. Yes, we got to prioritize ourselves. Yes, we got to swallow pills sometimes. Maybe, if we choose to. It's always our choice. I'm the guide. I'm the educator. You're the boss. You are the director of your own health, not me. So if you want to know more about estrogen and all the gory details of estrogen production in the liver, cortisol's effect on that, blood sugar's effect on that, testosterone's effect on that, the detox system's effect on that, serotonin and dopamine's effect on that. We can talk. You can spend the entire hour and a half you have in your initial visit, and I will talk about estrogen for an hour and a half if you want me to. When it comes to progesterone, I need to tell you that when menopause hits, in early menopause, it's progesterone that starts to decline first, typically. In a state of menstrual dysfunction, more commonly, progesterone becomes deficient first. Estrogen will stick around. Estrogen's tenacious. The body will produce that hormone. It helps us be empowered, get her done, get the tasks done. It's kind of like testosterone. It is estrogen. I would definitely, in my personal opinion, I would call estrogen a performance hormone, similar to testosterone. And of course, similar to cortisol. We talked about cortisol being a performance hormone in the testosterone video. Go watch it. Progesterone is also kind of, but progesterone I see is a little bit different. Progesterone helps us with our sensitivities, and it helps us with our five senses, and it helps us with our sleep cycles. It helps us with our feelings. It has its own superpowers, and they are no less than the estrogen's superpowers. In fact, I would argue that progesterone's superpowers are even more than estrogen superpowers. So don't discount progesterone just because it's more gentle and quiet and subtle. Progesterone whispers, estrogen sometimes yells. Look at both. The female system is absolutely fascinating. And if you're curious about it, I'll help you understand it.